Thank you, Mr. Chairman, and thank you all for being here today. Dr. Gottlieb, in your testimony, you say, among other things, that increasing FDA oversight of generic manufacturers is playing a role in increasing the cost of generic drugs. And you made a similar argument back in 2011 when you testified before the Senate Finance Committee and cited increases in FDA oversight as a factor contributing to drug shortages. So I'd like to examine that claim about the FDA's quote-unquote tighter scrutiny a little bit more closely. You know, one way that regulatory opponents often track FDA oversight is by looking at the number of warning letters that the agency sends out. And these letters basically tell a company to stop breaking the law or face the consequences from that. And there has been a significant increase in FDA warning letters in the past few years, from about 2,000 in 2011 to nearly 7,000 in 2013. That's almost a 400% increase. And it would certainly be noteworthy if those letters went to drug manufacturers. Do you know how many of them did, Dr. Gottlieb?
The warning letters went to drug manufacturers for manufacturing violations?
Well, no, went to drug manufacturers.
I would suspect a significant portion of those letters went to drug manufacturers.
Well, actually, my staff checked with the FDA this week, and it turns out that almost none of those letters went to drug manufacturers. Most of them were about tobacco regulations. In fact, in 2013, only 11 of the nearly 7,000 FDA warning letters were about generic drug manufacturing problems, and that was down from a grand total of 20 such letters in 2011. You know, you also suggest that if there is no imminent risk from a manufacturing violation, then manufacturing facilities should be allowed to continue to produce medications, Dr. Gottlieb. So I want to think about what that would mean. The FDA has noted that roughly 40% of the generic drugs in the United States are now manufactured in India. In 2012, Ranbaxy, a major Indian manufacturer, pled guilty to 7 federal criminal counts of selling adulterated drugs. And that same year, they recalled nearly 500,000 bottles of generic Lipitor that could have contained tiny glass particles. In 2013, the FDA imposed an import ban on another Indian manufacturer named Wockhardt after inspectors found urine spilling over open drains a few feet from sterile manufacturing areas and found mold growing in a storage area containing raw drug materials. So, do you expect us to believe that after 30 years of successful cost and quality control in the generic drug market, that the American public now has to choose between drugs that are much more expensive and drugs that come from dirty facilities, possibly contaminated with mold, urine, or glass?
Well, certainly not. What I actually said was that rather than issue of Public 483, which forces manufacturers typically to close facilities because of liability risks that they'd face, what we could do in cases where there's not an imminent risk is allow them to remediate those facilities under close FDA supervision. And that's exactly what's been done in a case, for example, under Team Biologics with vaccine manufacturers. Now, certainly urine on the floor of a plant would qualify as something you might want to close the plant for if you're under close FDA supervision.
Well, all right. So I'm sure there are ways that we could streamline our oversight of drug manufacturers. But let's be clear. India is producing 40% of our generic drugs, and the FDA's supposedly burdensome oversight team in that entire country consists of 10 full-time employees. That's 10 people to watch over the production of billions of doses of medicine to make sure that they aren't laced with broken glass or splashed with urine. So I'm sure that some generic drug manufacturers would like to blame their price increases on the FDA and its 10 full-time employees in India. But I think we need a deeper investigation into the price hikes. And frankly, I think we need more support for those FDA inspectors who are trying to keep our drugs safe. So, thank you, Mr. Chairman.